All right, welcome back everyone. Dr. Donahue here. Sarah's with me again. So today we're talking about the shoulder blade or the scapula and its role in shoulder function and if we are having shoulder pain. So just a little anatomy here. The shoulder blade is stabilized on the rib cage by four main muscles. So you have the trap that holds it on top, you have the levator scapula, you have the rhomboids right on the inside of the shoulder blade, and then you have serratus anterior that wraps around and really holds it onto the thoracic cage. From there, we have the rotator cuff muscles that stabilizes the arm bone, the humerus, in the actual shoulder joint. So off of the scapula, or off the shoulder blade, you have your four rotator cuff muscles that we kind of covered last week in your infraspinatus, your supraspinatus, your teres minor, and your subscap. Now all of these work together as one functional unit. So when we go up overhead, or if we go to the side all the way up, there's actually a ratio that the scapula moves compared to the arm bone. So the arm bone goes at a 2 to 1 ratio compared to the shoulder blade. Now if any of these muscles back here get dysfunctional, aren't working like they should, we might see some scapular winging, but more importantly, the shoulder mechanics are thrown off and we're going to start seeing shoulder pain. So a couple ways that we can test whether the scapula is functioning okay is we can go over here into this room.
And we can come on our hands and knees here.
Good. And we're going to have our hands right under the shoulders, good, knees under the hips, and a little bit further up here. There you go. And then we're just going to start to rock forward. Good. And you kind of see some winging here already. And then we rock back. Good. And then come back to neutral. And we can go side to side as well. So you see that right there. And come back. And this side. A little bit here, not as much as the left side though. So we can do that as one test. Another thing we can do, if we come back to the bench here, we can take a weight. If we had a weight here, and we would just go up into flexion there all the way, and then we would slowly lower that back down. We would probably do both sides and just look for some of that winging. So if that's the case, most often it's your serratus anterior that's either weak or it's just not turned on. So we have the capability of turning it on, but it's just not doing it. Another thing is if these start to become dysfunctional, we start to see this rounded shoulders. So now that you're in this position, go arms all the way up, and you're kind of limited there, right?
Yeah.
Okay, so then if we come back sitting, we can go all the way up. So that's kind of another thing that happens. So let's come on your hands and knees here. So just a couple quick exercises that you can do at home just to start firing. More than likely it's going to be the serratus anterior wrapping around here. Is you're going to pick your spine here straight up to the ceiling, and you're going to feel your shoulder blades wrap around. Kind of like that. So not as much here though. So keep that a little flat there. Now drop all the way down. Good. Keep those straight, and then we're going to come back up. Good. Perfect. And then if she can't do that, we're going to sit back onto the heels, just like that. And we're going to come down on the elbows. Good. Hands on the ground here. And if we had a band, we would put the band on, and we would externally rotate there, and that's going to start to, so this band is providing resistance, and then we're going to see the shoulder blades wrap around, and we're going to start to feel her activating right in this area down here. So those are quick tests we can do, quick things at home that you can do to start activating stuff. You can come back up. So next week we're going to talk about the middle back, the thoracic spine, and how it affects shoulder function as well. So thanks for tuning in. Thanks for watching. Don't forget to hit like, subscribe button. And we'll see you next week.